So welcome, I'm Hermann Einsele. I'm based in Würzburg in Germany, and I'm the director of the Department of Internal Medicine 2. So it's a great pleasure for me to present some data that I was allowed to show at the last EHA meeting in Vienna. And this presentation was entitled Subgroup Analysis in Patients with Relapsed Refractory Multiple Myeloma Receiving Real-Life Current Standard of Care in the LocoMMotion Study. So even with all the improvements that we have seen in patients with multiple myeloma, most patients with multiple myeloma eventually have disease progression after treatment with standard drug classes with PIs, IMiDs, and anti-CD38 antibodies. And there's clearly an urgent unmet medical need for patients with relapsed refractory myeloma who have received at least 3 prior lines of therapy. And so in the LocoMMotion study, which was a multinational study mainly recruiting patients in Europe, efficacy and safety was assessed of real-life standard of care therapy in heavily pretreated triple-class exposed patients. And in this study, we presented at the EHA a subgroup analysis of patients treated in this LocoMMotion study. So the study design was a prospective non-interventional study conducted across 76 sites in 9 European countries. Real-life standard of care treatment was defined as those used in local clinical practice as previously described. Response and disease progression were assessed by Response Review Committee per IMWG criteria, and patients were enrolled between August 2019 and October 2020. Key eligibility criteria were documented multiple myeloma, an ECOG performance status of 0 to 1, measurable disease at screening, and having received at least 3 prior lines of therapy or refractory to PI and IMiDs. And they had to have disease progression during or after their last line of therapy. So in this study, we really looked into patients and to patient characteristics associated with generally worse efficacy outcome of the standard of care therapy. And what we found is that the following criteria were associated with a worse efficacy outcome: triple-class refractory patients, penta-drug exposed patients, penta-drug refractory patient, an ECOG performance status of 1 or higher, poor renal function, which was defined as a creatinine clearance lower than 60 milliliters per minute, an ISS stage 2 to 3, presence of extramedullary mastocytoma, high LDH, bone marrow plasma cells of more than 60%, and high-risk cytogenetics. So in summary, the LocoMMotion study is the first prospective study of real-life standard of care treatment in triple-class exposed patients with relapsed refractory multiple myeloma. Characteristics associated with worse efficacy outcomes included triple-class and penta-drug refractoriness, ECOG performance status 1 or higher, poor renal function, ISS stage 2 or 3, presence of extramedullary disease, high LDH, high bone marrow infiltration, and high-risk cytogenetics.